like to do terribly well is to just draw the liver there, because obviously the interesting aspect is that blood from the GI will have a hepatic portal vein, which is really blood from the GI, which goes into the liver, but the liver gets its own oxygenated blood supply from the celiac axis in the form of a hepatic artery. So we have two blood supply to the liver. So that we have the hepatic artery, which is the actual oxygenated blood, where with the majority of the oxygenation needs for the liver, but it also receives blood from the hepatic portal vein, which is blood from the GI system full of all the nutrients that we eat. And from the liver we then have a portal vein which then joins into the inferior vena cava. So the process that again IVC. And also another important thing which I like to mention in this section is the carotid arteries, like where they come from and what the coronary arteries. Sorry, I can't believe I said carotid. The coronary arteries. So it's safe for to look at the heart from a superior aspect to try and find our coronary arteries. We'll find the pulmonary valve, which is this one sitting. So this is the anterior and this is the posterior aspect. So we'll have our pulmonary valve and its three cusps. Just posterior to the pulmonary valve we'll have our aortic valve and its three cusps, and right at the top of this, so this is the aortic valve there, so this is the AV. So right superior to the aortic valve we have our carotid arteries. So if we're to look at the superior aspect, we'll find that the right common carotid arises from here. Did I say common carotid? I meant to say right coronary artery. Why am I saying carotid? I mean coronary, and the left coronary arises from here. Left coronary artery. So they arise just superiorly to the right cusp of the aortic valve, and just superior to the left cusp of the aortic valve, the left. And then obviously we'll then have our mitral, our tricuspid valve there on the right hand side, and our mitral valve there. So if we're to look from a superior aspect, this is what we'll find. We'll find the pulmonary valve sitting just in front, and then we'll have our aortic valve, and the coronary arteries will be coming off the aortic, just superior to the aortic valves. The right coronary will then bifurcate and give blood supply to the SA node, which is there. So the branch that it gives is called a marginal branch, simply because it lies on a marginal angle. So that marginal branch then supplies blood to the SA node and the AV node. The right coronary also gives a posterior descending, which supplies the posterior aspect of the ventricles, the posterior wall of the ventricles, particularly the right and particularly the right ventricle. Then if we're to look at the left coronary artery, we'll find that it forms a left descending branch, which is a branch that is found on the anterior aspect of the heart. And the left descending supplies the left ventricle and the septum and all the bundles of hairs. So when we have, say, a left bundle branch, it's usually because of an occlusion on the left descending. So it supplies the anterior aspect of the left side of the heart. So then we'll have a circumflex, which supplies the posterior aspect of the heart, including the septum, and again all the coronary arteries. Like these are the important ones, as in the marginal from the right, the left, the posterior descending artery, and then if we have this as the left descending artery, like anterior descending, in fact, left anterior descending, and then circumflex, which quickly makes a sharp turn to go posteriorly. So if we're to look from a superior position, this is what we'll find. These are the main branches. Obviously, there are other collaterals which allow that for, to give a continuous supply to the heart muscles. Say, if there is an occlusion somewhere else, they then make up for that by still providing oxygen to the myocardium. But the important thing to mention about the coronary arteries is that when I do ECGs, they will become important because we'll then be looking at where a problem is. For example, I've already mentioned left and right bundle branches. We'll be looking to see where is the problem. So if we have this problem, what artery could be affected there? For example, if we have conduction defects, we know that the SA node and the AV node are mainly supplied by the marginal artery, which comes from the right coronary artery. So if we have conduction defects, say blockage or bradycardia, so we will know that this is something to do with this. This is a blockage from the marginal artery of the right coronary artery. So the coronary arteries become quite important. Well, they are important, but then they also fit nicely when into the ECG and into impulse generation. So we'll have to revisit them again and do them a bit better. So in this section, I'm afraid I'm going to have to rub all of this out because I haven't got enough room to do a quick summary of what I've covered in this section. I'm working from home, so I don't really have that many resources other than this whiteboard. So really a summary of this introductory section. So summary is that I've discussed the two sides of the pump of one pump, which is the heart. So we've discussed how blood comes from the vena cava. I was just going to say write VC. How blood comes from the vena cava, from the superior and inferior vena cava, and importantly, another source from the coronary sinuses. All of this blood goes into the right atria, passes through tricuspid valve, enters the right ventricle, passes through the pulmonary valve, enters the pulmonary artery. So this is the pulmonary artery, goes into the lungs, gaseous exchange occurs, blood then comes out of the lungs, enters the left, blood comes out of the lungs, enter the pulmonary vein, and then from the pulmonary vein, blood then enters the left atrium, and then from the left atrium it passes through the mitral valve, flows into the left ventricle, passes through the aortic valve. So the mitral valve really is a bicuspid valve, enters into the aortic valve, which is another tricuspid, into the aorta and the body. This is the body. So this is the aorta. So, and the first branch from the aorta are the coronary arteries, which feed the heart itself.